facing a complete panic situation in terms of COVID-19. The latest data on new daily cases shows that we have crossed 1,60,000 fresh cases in a single day. The bulk of those cases continue to come in from Maharashtra, which has crossed the 60,000 daily cases mark. And now there are reports that the government is mulling over a lockdown which could be implemented as early as the middle of this week. Whether it's 18 days, 8 days or 14 days is the question right now. In the midst of this, a top industrialist, Bajaj auto boss Rajiv Bajaj, wants to ask the government 8 simple questions over whether this lockdown is truly valid. Before I come and speak to Rajiv Bajaj, I want to just run those questions for you. The first one is, what is the actual incremental mortality? What percentage of cases are asymptomatic or mildly symptomatic? What's the exact criteria for mandatory hospitalization? How exactly will mandatory RT-PCR testing be implemented? Why aren't we first diligently doing the doable, like masks, distancing, work from home, instead of restricting further operations? What's the result of all the porous and partial lockdowns of the last 1 year? What's the ability of the government to extend lockdown support if it does choose to go in for a lockdown? And this is the important one. Why shouldn't people resort to civil disobedience if the government will put election and melas before logic and vaccines? Now, why is he asking these questions? We will counter him on each one of these. In fact, thank you so much, Mr. Bajaj, for joining us on ET Now this afternoon. Let me start by asking you about why you feel the need to pose these questions and why you're so worried about another round of lockdowns in Maharashtra at a time when numbers are surging.
Well, simply because, Tamanna, I am speaking with you from Pune, which is one of the hotbeds of COVID. And we are apparently staring at the prospect of another lockdown, although we don't know much about the exact nature of this proposed lockdown. And in this context, I think, we have to all ask ourselves, what are we going to do differently so that we don't end up with the same result that we've had over the last 12 months? And while reflecting on that, 8 questions that you just elaborated came to my mind. And I think we need the answers to this so that we can go from reacting to unfounded fear to responding to the unshakable facts.
Now, you ask about actual incremental mortality. How do you calculate incremental mortality? What we do know is 169,000 Indians have died of COVID-19 since the pandemic began last year. Isn't that number scary enough to really justify taking whatever means possible to save lives?
Well, as far as I know, pre-COVID, it is said that 7.5 lakh people die in India every month for one reason or the other. And as you just mentioned, as far as COVID is concerned, it has been about 169,000 over the last 13 months, which points to 13,000 a month on an average. Now, what this suggests to us is that at the maximum, the incremental deaths are 13,000, which means every month, instead of 7.5 lakh people, 7.68 lakh people, 63 lakh people have died. However, when I speak with local doctors in Pune, they insist that 70% of such deaths are people who had various comorbidities, whether it's obesity, hypertension, diabetes, whatever. This has been talked about ad nauseum, which means that the maximum incremental death is not just under 2%. It is probably well under 1%. It is probably closer to 0.5%. And this seems to mirror exactly what the Delhi Chief Minister, Mr. Arvind Kejriwal, said in an interview yesterday, where he said that as far as Delhi is concerned, he finds that the mortality rate is a third of what he saw in previous months during the first wave or the second wave, as he called it. Now, I am not for a moment suggesting that every life is not precious. I mean, as someone said, one death is a tragedy and a million a mere statistic. So every life is important. But if we have another hard lockdown like we did last year, we are all aware of how many people who needed medical assistance for various other problems could not avail of that. What about all the lives lost in the process of doing that? So that is why I think this question is important for me, that what is the actual incremental mortality, whether at the national level or specifically at the state level, and how does that compare with people who perhaps otherwise lost their lives because they couldn't get help?
You know, Mr. Bajaj, the question is that how would this change the outcome of what a government decides to do? This is a question which was being asked last year as well, that the number of people actually dying are low. So should a larger number of people then be made to suffer through a lockdown and the economic outcome of it? But at the end of the day, doesn't it come down to the same thing, that even if 80% plus of the cases are asymptomatic, as is one of the questions that you pose, a government will have to ensure that those who are vulnerable are not infected? They can't really sit around doing nothing.
Absolutely, I agree with you. So let's take point number 2 and 3. As you just mentioned, apparently the case severity profile seems to suggest that almost 95% people are either asymptomatic and tested positive as a result of testing, tracing, etc., or are mildly symptomatic and can be treated at home, as again Arvind said in his interview yesterday. And here, in fact, I would like to mention that, I take my hat off to our Chief Minister and those in administration here, like the BMC Commissioner, Mr. Chahal, who have been extremely proactive and extremely transparent when it comes to sharing such information. But having said that, what this leads to then is that if the vast majority are indeed asymptomatic or mildly symptomatic, then should one really impose a lockdown on the 130 million people of Maharashtra, say in this case, who will suffer because they will lose their jobs, they will lose their wages, and many of them are on the verge of losing their minds. Let's look at the specific issue of hospital capacity that has been talked about so much, which is my question number 3. Local doctors over here suggest that a large number of hospital admissions are to do with the VIP syndrome. I mean, I am guilty of this on almost a daily basis because I am being approached by people who are seeking my help to get a friend or a relative admitted. This is happening every day in the hospitals in Pune. There are people that are admitted out of fear. There are people that are admitted out of sheer convenience, when all of them could actually be treated at home. And frankly, I have to make the point that some hospitals are not exactly complaining. Anecdotally, I will share with you what happened with a close friend last week whose domestic staff needed to be hospitalized, but was kept on in hospital for much longer than required. This gentleman was in the general ward, and the bill at the end of his treatment was 4.36 lakhs of rupees. So, not all hospitals are exactly complaining about this. And I, therefore, would very much be curious about what the exact criteria for hospitalization is. And I would like to ask or suggest that maybe if hospitals are more than 70% full in terms of their COVID capacity, perhaps at random, we need to audit them and see whether all the people who are there really do need to be there. And let me tell you why. Because let's assume for a moment that my anxiety is unfounded, and let's say everybody that is in hospital causing a shortfall needs to be there. Then perhaps the government needs to tell us that if they lock down for 14 days, let's say, for example, how will they achieve this so-called medical infrastructure capacity, which they could not achieve in 14 months? How will they achieve it in 14 days? And we know the most important component of that is not the bed or the oxygen cylinder. It is actually the staff, the trained doctors and nurses and paramedics. And I would really like to know how in 14 days or 21 days, we are going to create a new army of well-trained staff when we couldn't do it in the last 14 months?
You know, what you're pointing to, Mr. Rajiv Bajaj, and if I may put it broadly, is that in the last over a year since COVID-19 hit, not enough has been done to prepare for a second wave, and we find ourselves in the exact same spot with worse numbers a year later. Is that the broad thinking behind what you're saying?
Well, I would say that's part of it. But what I'm also trying to suggest is, that someone said insanity is when you do the same thing again and again and expect a different result. I'm asking my government, and fortunately I can ask this of my state government because all my interactions with them suggest that they are very open-minded, very objective, they listen and they care. And I'm asking them, what is it that you are doing differently now which will produce a different result? I mean, we are talking about all the mutations of the virus. Well, let me tell you, sitting in Pune with plants in Pune and Aurangabad, I have seen all the mutations of the lockdown as well. I have seen the 10-day lockdown. I have seen the 7-day lockdown. I have seen the weekend lockdown. I have seen the overnight lockdown. I would like the administration to share with me some information on this and tell me how effective those were. And if they were not effective, then for God's sake, what's your reason to do more of the same all over again?
You know, I want to take up the RT-PCR question and link this to what concerns you have for Bajaj Auto facilities in Pune right now. So every 15 days, there has to be an RT-PCR for those who are continuing to work, for essential workers. So far, none of the restrictions actually stop work in plants such as yours. What's different from last year is that movement of goods, etc., is allowed, night shifts and all of those shifts are allowed. So are you facing any difficulty in the RT-PCR matter, and overall what has been the impact of the second wave restrictions on your business?
So Tamanna, the short answer is, as of now, there's a lot of concern, a lot of anxiety. There is no actual impact because nothing has changed so far. We are awaiting apparently a decision later in the week. And before I answer your question, let me say this, that I don't pretend to have the answers. I started by saying that I have some questions, and hopefully these are valid questions. Now, as far as RT-PCR is concerned, my perception is that we may, in terms of what has been recently stipulated, have a cure that is almost worse than the disease. I mean, it seems to me a classic case of over-regulation where we want to test everyone and therefore deny the needy the ability to be tested. Let me give you a specific example. I'm given to believe that in the office or in the factory on the shop floor, if a person is positive, well, that unit must be shut down or the section must be shut down and sanitized, etc., etc., and then only work can start again. Now, I am not able to understand a simple thing that if someone feels unwell, am I supposed to shut down immediately? Because at that time, at that point of time, he is not tested. And I'm not sure whether he or she is suffering from COVID or just some other flu. And thanks to what has been mandated right now, that, for example, in industry, every 15 days, all employees must do the RT-PCR test. Taking a cue from that, you may have heard that in many societies, they are mandating that if you're going to go in and out of the society, then you need to do so with a recent RT-PCR test. Now, all of this has imposed such a huge load on lab capacity and kit availability that a person who is feeling unwell on the shop floor or in an office today will probably not get his result for the next 48 to 72 hours. And it's going to be such a weird situation that for those 48 hours, we will continue to work because we do not know whether he will turn out to be positive or negative. And at the end of 48 hours, if he is positive, we will shut down, although in the meantime, we may have already infected half a dozen other people. So, I mean, this is just entirely impractical from my point of view.
You know, the question you pose, and I think this is another very important one, where you say, what's the ability of the government to extend lockdown support like Western countries if they wish to lock down as well? And this is important because the lockdown has been the weapon of choice against COVID-19, not just in India, but across the world. We were one of the first few to do it in a very stringent fashion. But the fact is that everyone's done it. Over this weekend, Bogota, Argentina, France, Germany have different kinds of lockdowns. Italy, Slovenia, etc. coming out of lockdowns. So what is the model you propose? Is it like Brazil, where their head of state is refusing to extend any lockdown no matter how infections and deaths rise?
No, not at all. And you see, if you just reflect on all the nations that you name, these are all Western countries with a very different immunity profile from that of India, which is much more like the ASEAN countries. And you would find a lot of answers if you looked at what Thailand has done, what Vietnam has done, what Malaysia has done, what Cambodia has done. And I am not suggesting that lockdown is right or wrong, but I am suggesting that lockdown is a coin that has two sides. I mean, if one side of lockdown is to lock people up, then the other side of the lockdown is to provide very real, tangible, significant, immediate support to the people that you lock down, and not just to the big companies like Bajaj. I mean, today my partners in the UK, Triumph, and that in Austria, KTM, have received significant direct support from their governments. For example, 80-85% of wages of furloughed employees have been compensated. But I am not even asking for that. I am asking the question on behalf of the millions of MSMEs and the so-called informal sector. You know, the little restaurants, the shops, the gyms, the spas, the salons, that sort of thing. And let's say, I think at a time of crisis, Tamanna, more than any other time, should not our leaders lead by example? Should we not walk the talk? I mean, you are asking people to wear masks when your leaders are canvassing for elections without wearing masks half the time. You are asking people to distance when people have seen this morning the so-called second Shahi dip at the Kumbh Mela, to which you are inviting people from all over the country. I mean, how can we have this kind of dysfunctional behavior and then expect alignment in the country for a lockdown, which is actually hurting the lives and livelihoods of people?
So, when you say that why shouldn't people resort to civil disobedience if the government puts election and melas before logic and vaccines, are you seriously suggesting civil disobedience, Rajiv Bajaj?
Look, let me tell you the background to this, okay? What is it I believe would be an appropriate middle path? First of all, I have always said for the last 1 year, for whatever it is worth, because I am a layman, frankly, as far as this subject is concerned, that all those who are deemed to be vulnerable, either by age or because of comorbidities, they should be secured. They should be kept at home or in some other safe place wherever they can be conveniently housed. There is no two issues about that. This population, fortunately, is perhaps 5-10% of our total population, and hardly any of our working people fall into this category. We are also all for work from home. I mean, we have proactively at Bajaj already moved towards work from home again, because we are adults, we can think for ourselves, and we don't want to cause trouble for ourselves and for our colleagues. So up until here, it is fine. But when it comes to the rest of it, i.e., for example, to manufacturing industry, where you cannot work from home if you are making a motorcycle, then you need to be at the workplace. And I want to give you, in that context, the specific example of our plant at Aurangabad last year, about which so much misleading information has been put out. This plant was shut down on 24th of March last year when we announced a national lockdown. And this plant was given permission to start exactly a month later on 24th of April. And let me tell you, from 24th of April, for a whole 6 weeks, until 6th of June last year, there was not a single case at the plant. Why did the case happen on the first case occur on 6th of June? Well, you don't have to take my word for it. You can see the interviews given by the collector of Aurangabad at that time, who said that it has happened because from 1st of June, the city was unlocked. The virus is created or spread in the city not in paint shops and machine shops. The virus is brought to the plant from the city. So what I am trying to say, therefore, is that shutting down particularly manufacturing industry and all such other MSMEs where people need to be on site to work is not going to work because it simply hasn't worked. And if at all we have to do it, we should do it by looking at the East and benchmarking the East and not the West. And finally, if we are going to benchmark the West, then for God's sake, have some empathy for people and give them simultaneously the same kind of lockdown support that Western countries that you named are extending to their people.
What is the lockdown support? So as of now, the reports we have is that the Maharashtra government is sitting with its top team and mulling that if they do bring in a lockdown for 8 to 14 days, that they will be extending some financial support. It's very unclear what that would be and what our financial capacities as a state and as a nation more broadly are to give that kind of support. But what, in your view, would be ideal to save all of these small businesses that you've mentioned?
I would simply say that we have to help those people to keep their nose above water. Now, whether it means salaries, whether it means their rent, whether it means, for example, there is so much chaos right now that just 2 weeks ago, I renewed my licenses for my shop or my bar or my restaurant or whatever it was. And now the government has announced a lockdown conveniently a week later, almost as if it was premeditated. So whether it's salaries, whether it's electricity, whether it's rent, or anything else that can, any other cost head that can be subsidized or supported, that should be done. But as I said before, it has to be direct, it has to be significant, it has to be immediate. All these big packages with lots of zeros at the end of it that nobody can figure out how and when they will trickle down. I don't think that is the kind of support that is going to help people, at this point of time.
Just a broad comment from you on how we are dealing with the second wave and the vast difference in how it is panning out in different parts of the country. Maharashtra continues to be the epicenter, and some say because there are higher levels of testing, while in other parts of the country, as you mentioned, it's business as usual. There are political rallies, they're going into elections, etc. Is there a concern that this kind of behavior will ensure that we don't exit the second wave as soon as we possibly could have?
Well, first of all, again, full marks to my government here in Maharashtra for being as upfront as they have been. Having said that, my view on this is somewhat controversial, that I believe that if indeed mortality is like 0.5% or lower, and if indeed 95% of the people are mildly symptomatic or asymptomatic, then frankly, I think we are moving towards herd immunity in perhaps not the best way, maybe as we discussed in terms of how hospitals are managing, in terms of how testing has been mandated, in terms of the ABC of COVID, which is the appropriate behavior for COVID, in terms of masks and distancing. We can do better. Both government can do better and people can do better. But otherwise, it appears to me that without waiting for the vaccine, we are moving quite happily towards a sort of herd immunity. Now, what we can do further better, obviously, for those who want to take the vaccine, is to give it to them, quite simply. And unfortunately, the popular perception is that for a year, the people of this country have waited for a vaccine panacea. And now what they are witnessing is actually vaccine politics. And as you said, business as usual. Well, if politicians will carry on, or some politicians will carry on with business as usual, then yes, there is a side to me which feels like saying, why should all of us not carry on with business or life as usual? In that context, it is out of frustration and not in a sense of irresponsibility that I say, maybe it is time for some kind of a civil disobedience movement. No individual or no individual organization can do this, but maybe it's time that associations like a Maratha Chamber, like a CII, like a FICCI, like a ASSOCHAM stood up and said something. I mean, it's time that CEOs of small and big companies stood up and said something. I mean, why are people like us sitting in big chairs and earning fat salaries? I mean, more than any reason, it is because we are supposed to shepherd our flock when there is a difficult period. We are not supposed to be sheep in front of government when there is a difficult period.
Yeah. Just one last comment, Mr. Bajaj. You said so far that on your business and on your manufacturing capacities, there has been no impact, but there is concern and anxiety. Do you see that changing if there is a prolonged period of high infections, lockdown? Do you think it will impact things like demand, which started picking up in the middle or late last year? Do you also see the commodity cycle and high commodity prices eating into that?
I think commodity prices, although they have been unusual in the last few months, the increase in them, that is something, quote unquote, management must manage. But I am not able to answer your primary question simply because, A, I do not know what the lockdown, if at all, may hold for Bajaj. For example, will they allow the plants to operate because they are outside the city limits? Will they allow us to operate at 50% capacity? Will they shut us down completely for 15 days? I don't know. Similarly, in terms of dealerships, I mean, I hear of several states and several cities where dealers are shut, but I hear of others where they are open. So again, I don't know what's going to happen there. And I am especially concerned about the suppliers who do not necessarily have the resources or the clout that the OEMs do. And I do not know how they are going to manage their men and their material. So, frankly, anything I say right now will be speculative. We have to wait and watch to see what the government decides, and then we have to respond.
Well, we will wait and watch. Meanwhile, thank you so much for speaking with us. As frankly, as usual, Mr. Rajiv Bajaj of Bajaj Auto, they're talking about how a lockdown is perhaps not the answer.